And happening today, the Council on Recovery is hosting a conference on substance abuse and the importance of bringing together mental and physical health. This is to help increase awareness, improve health outcomes, and save lives. I'm actually leading one of the panel discussions today, and joining me right now to tell us more is the Council on Recovery's Diane Arms and Dr. Christina Iman. Good morning.
Good morning.
Good morning.
So first, actually just explain to our viewers, how big of a problem is this in Houston? Does Houston have a big issue with substance abuse?
Well, Haley, I would say that across the nation, we have a big problem with substance abuse. And Houston is like everywhere else, where about 10% of the individuals living in the county have a problem. So that's about 500,000 people here in Houston. But of that 500,000, only 10% receive the treatment, which is really disheartening because we have effective treatments that can help individuals, overcome their addiction.
And so what is the event all about today? Like, how is that supposed to be, helping with bridging this gap, so to speak?
Yeah, so the Center for Co-Occurring Disorders within the Council on Recovery is putting on a Closing the Gap symposium today. And basically it's to educate the community as well as providers on integrating substance use, mental health, as well as physical health and community together to ensure we're providing a holistic approach and giving the best access to our services, whether that's in a primary care setting, in the criminal justice system, all over. So basically it's a big event to raise awareness and ensure people have the tools, resources, and knowledge to integrate care within their own settings.
Can you tell our viewers who all you got, what kind of national leaders people can expect to see there today?
So last night we actually kicked off the event with our evening with Michael Botticelli, who is the former executive director of the White House Office on National Drug Control Policy. So he did an amazing presentation on stigma and shame and the manifestations of it. Today we actually have our opening keynote at 9 a.m. with Dr. Gendocha, who's the Chief Medical Officer of SAMHSA, which is the Substance Abuse and Mental Health Services Administration. We have other amazing breakouts today talking about the pharmacology of addiction, as well as obsessive compulsive disorders, chronic illness. We have the Chief Behavioral Health Officer of Boston coming to talk about safeguarding the mental health of a city. We have our amazing panel, which I know you'll be here today to do. And we just have a ton of different experts in the field coming to really shed light on how to do this together as a community.
Well, I know that one of the things that we're going to be talking about today is closing the gap between mental health and physical health. And even when I've told people what I'm doing today, they say, okay, so you're talking about mental health or you're talking about physical health. People still don't want to merge the two together. Can you explain why you believe they're so closely integrated?
Sure. Physical health and mental health and substance use all live in one human, right? And so we're trying to take a holistic approach and getting people to understand that if we at least acknowledge that there's an issue in one of those, the others will be impacted. Research shows that if you help an individual with their mental health or their substance use, then you will definitely have better patient outcomes in their diabetes, in their hypertension, et cetera.
What is the demographic for substance abuse? Because some people's minds will immediately go to a kid or teen. Others will think about young professionals. I mean, are we talking about moms? Are we talking about older people here? Who all can be affected by this?
I am so glad you asked that question because addiction is a non-discriminatory disease because it is a disease. It's a chronic medical condition. It impacts everybody. So everybody is capable of having an addiction. The only issue is that the disparities lie in the access. So that's where the council comes in. The council is able to see any individual regardless of the possibility of payment.
I love that. And you guys can also give people access to Narcan if they need it. Is that right?
Absolutely. We just secured a large amount of Narcan, and it is a life-saving medication that we can give to our community.
What do people have to pay for that?
Well, if they come to the council, they can actually pick them up right at our Welcome Center for free.
Excellent. What about, when you're a family who's dealing with something like this, it can feel like a very overwhelming struggle. And I think the question that most families have most often is a full recovery possible? If someone reaches out for help, can they ever fully get better?
Absolutely. Well, we also like to say, though, because addiction is a chronic medical condition, this may be lifelong. So we want to make sure that we treat all of our clients and all of the individuals who are suffering from an addiction with dignity and respect, and treat them just like if they were to have diabetes or hypertension or any other chronic medical condition. But absolutely, they can live a fulfilling life.
Dr. Iman, do you have something to add to that?
Not really. I think we touched on everything, but I know that today we have, again, amazing speakers. The community is really rallying behind bringing in the gaps in care and ensuring we have access to our entire community. So.
Okay, Diane Arms and Dr. Christina Iman, thank you so much for joining me this morning. Anything else you'd like to say before I let you go?
Give us a call, 713-942-4100, if you or someone you know needs help.
Yeah, you guys are right there off of the Memorial Parkway, easy access for most Houstonians. We will be sure to clip this and put it on our website, click2houston.com. Thank you for joining us this morning, ladies.
Thank you.
Thank you so much.